Our study looks at post-operative mortality, so that's deaths occurring within 30 days of an operation in English hospitals between the years 2008 and 2011. So we actually looked at 3 years of data. We looked at death rates by day of the week, looking at death rates between Monday and Friday, and also looked at weekend death rates as well. And we focused on planned surgery, so elective admissions. Now, the reason why we looked at planned surgery is that previous work has looked at emergency surgery, and in fact we published ourselves some work a couple of years ago looking at mortality rates from emergency admissions in patients admitted at the weekend compared to the rest of the week, and we found about a 10% increase in the risk of death. And a number of other groups around the world have also found a similar result. We looked at over 4 million operations carried out over a 3-year period in English NHS hospitals, and found during that period just under 28,000 deaths. So we're really looking at a very low mortality. Less than a percent of operations end in a death. But what we found was an increasing mortality rate as a patient's operation approached the weekend. So we found around about a 44% higher odds of death on a Friday compared to patients admitted on a Monday, which suggests around about a 40% increase in risk of death. We found a higher risk of death in patients operated on over the weekend, around about 80% higher, but one can't exclude the fact that actually patients operated on at a weekend are probably a slightly different mix of patients than during the rest of the week. We tried to account for some of the explanations. So first of all, the kinds of patients operated on during the week might be slightly different towards the end of the week and at the weekend compared to the beginning of the week. And so we tried to take into account some of the factors that could contribute to this. So we adjusted for age of the patient, the overall risk of the types of operations that these patients were having, and a number of other factors. So we tried to account for those potential differences, and actually when we looked at these factors, there wasn't a great deal of difference between those patients operated on a Friday and those patients operated on a Monday. So we were able to take into account some factors, and that leaves us with one possible explanation that this increasing trend in mortality rates is due to poorer quality of care at the weekend. However, this type of study is an observational study, and it's very difficult to draw those kinds of conclusions just looking at routinely collected data. But that's certainly one of the explanations that we might want to consider if we're going on to do some further work.